Hello and welcome to Big Answers for Little Patients, a podcast from UNC Children's in Chapel Hill, North Carolina. UNC Children's is a major referral center for children with complex conditions and consistently recognized as one of America's best children's hospitals. For more information on UNC Children's Hospital, go to uncchildrens.org. Today, we're going to focus on behavioral health, also known as mental health, for children and adolescents, and what UNC Health is doing to help make a difference for them. Our subject matter expert today is Dr. Samantha Meltzer-Brody. Dr. Meltzer-Brody is the Assad Maimandi Distinguished Professor and Chair of the Department of Psychiatry at the University of North Carolina at Chapel Hill. She also directs the UNC Center for Women's Mood Disorders, and as chair, Dr. Meltzer-Brody directs one of the largest public university departments of psychiatry in the United States and collaborates with UNC Health and the state of North Carolina on broad-based initiatives to improve mental health. Dr. Meltzer-Brody, thank you for joining us, first of all. And I want to read some stats to you and tell me if they sound about right. There's a recent article in the Wall Street Journal noted that data gathered from 38 children's hospitals by the Children's Hospital Association found that trips to emergency departments for mental health treatment were 20% higher in 2022 as compared to 2019. Does that sound about right to you? And are children seeking help in ERs for suicide? One number that I saw said that number was had gone up 50% at those hospitals during the same period. Do those numbers ring accurate with you?
Yes, unfortunately, Phil, they do. The pandemic was very, very cruel to the mental health of many people, but particularly our kids and adolescents. And so the rates of child and adolescent mental health crises, including suicide attempts and severe presentation of psychiatric symptoms, has led to our seeing record numbers of kids in emergency departments. And so the mental health crisis was already brewing pre-pandemic, but it became much, much worse. So over the course of the pandemic, over the course of 2020 into 21, the prevalence of anxiety and depression and suicide dramatically increased. So that's why you're seeing such a difference in the rates that you just mentioned.
Okay, and still quoting from that same story, they were saying children's demands for emergency mental health services has eased from the pandemic's extreme highs, according to an analysis of records of more than 1,100 hospitals by the research arm of Epic, which we use in our hospitals, Epic Medical Records. But what's causing this other than the pandemic? I mean, what's going on with our children and adolescents and their mental health?
Yes. Well, thankfully, I think we are seeing things subside a bit that, from the worst moments of what we saw in the pandemic. But I think that is complicated factors. We know that our kids are deeply impacted by social media and living in a world where they are tied to devices. The types of feedback they get on social media and other things can be very, very difficult for some. There's a growing evidence base on how all of these things can be particularly harmful to certain groups, including teen girls. We know that people in the LGBTQ community and other underrepresented minority groups have higher levels of stress and distress. So that's one contribution. I think that there's also enormous amounts of, social discord, if you will, in the world. And I think that we're living in a time where there's a lot of socio-political discord. People feel stressed. Kids are growing up in environments where their parents are stressed and can be stressed about any number of things. And when you talk to a lot of teens, and even younger kids, obviously not the little kids, hopefully, but they really internalize this. I mean, I think they're feeling like the future feels uncertain in many ways. And there is a certain amount, I think, of great concern that leads to anxiety and depression about how we're going to get on the other side of multiple different things that we're facing right now. And I think that all of those things can be combined if they don't have adequate social supports. And that's another thing, that often families are spread out and there's not necessarily the support they need. That all of these things combined can lead to worsening mental health.
Yeah, I mean, so I have some very specific questions about some things that are going on and some initiatives that we're doing. But first, I was going to ask, so what do we do? I know it can't be an easy fix, but what should we be doing?
Well, I think that there's a number of different initiatives happening. I believe that we have to face head on the impact of the internet and social media on our kids, and there's multiple things happening that we can't let that go just unregulated, that parents have to get involved in that space, and we really have to know what's going on with kids in that space in a different way than we've had. I think that really helping to increase mental health literacy and helping give kids tools on how to manage their stress, manage anxiety, teaching coping skills, teaching ways to engage in really constructive and healthy ways of managing stress. All of these things are really important. And oftentimes, I think, again, if kids are not out and interacting in ways that we would like, and some kids are really just focused in this very insulated electronic sort of space, they don't have a chance to develop those skills in ways that we would like. So I think that being aware of that, teaching mental health literacy, teaching the things I've talked about are really important from a prevention point of view. And then, of course, we need to, on a continuum from how you prevent things to how you treat things, we need to have early detection of kids starting to struggle with mental health concerns so that we can have school-based programs, that there's opportunities for them to be getting interventions through primary care, and then an escalation of resources and interventions that will be appropriate for the level of severity that you see. So if you're not able to manage these things sort of on the front line, and I see that the schools often being the front line and primary care doctors, pediatricians being the front line, then how do you make sure people get into outpatient mental health appointments? And one of the things we've started, as you know, at UNC is intensive outpatient therapy for our teens and young adults, that if you need a higher level of care from routine outpatient care, making that available. And then certainly for kids that need inpatient hospitalization, our new psychiatric hospital can provide a much higher level of care in a way that we can hopefully make a big difference for the kids and teens that we're serving. So it is going to be a multifaceted approach. And I think we have to look at it over a continuum from really mild to very severe, and getting the individual to the right level of care depending on where they are.
Okay, I wanted to ask you a little bit and to get you to tell us a little bit about two UNC Health efforts to help in the situation. So first one, UNC Health is planning to build a freestanding children's hospital. And we'll want to talk about that. And then we'll move on to the YBH, or the Youth Behavioral Health Center. It's a new mental health hospital for youth and adolescents. So first, we'll talk about the children's hospital. So the legislature this year included $321 million in its most recent budget. Now, we know that's not going to be the full price or anywhere near it, but it's a really good start for a freestanding children's hospital in North Carolina. Can you tell us a bit about that and its importance to serving child and mental health needs in North Carolina?
So it's I think, an incredible step forward, and we're all very excited about the possibility of having a freestanding children's hospital. And the legislature and the money set aside dictates that there needs to be 100 child and adolescent beds in this freestanding children's hospital that will obviously also take care of medical and surgical specialties related to kids. So I see that as huge because we will be able to have a state-of-art facility that, in addition to providing expert care across a range of medical and surgical issues for kids and adolescents, will make mental health a priority, and that we will be able to have it scaled up to, having 100 beds will be significantly more than we have now, and will enable us to have specialty programs and really try and address that high level of care for people that need inpatient treatment.
Right. Okay. Thank you on that. And again, that one's going to take some time. I mean, you're building a huge facility like this. We're talking, what's the timeline in years? I've heard pretty wide fair estimates. What's the best guess?
Well, I honestly, I don't know, other than what I'm hearing too, but I've been hearing 7 to 10 years tossed around. And
yeah.
I think that, all of these things generally take longer than we want them to. It's unusual for any of them to take less, but I think that if we all would know that a decade from now that, we'd be in a new facility, I think everyone would be very happy. And if it happens any sooner than that, then that would just be icing on the cake. But it's an incredibly exciting thing to think about and plan for the future.
Right. Great. And then also want to ask you about something more immediate, a little more immediate. The UNC Hospital's Youth Behavioral Health Hospital. We call it YBH. I'm sure that name will probably change at some point, but this was formerly the R.J. Blackley Alcohol and Drug Abuse Treatment Center. It's a facility that was built and that's correct, built and operated by the state of North Carolina. And then Department of Health and Human Services asked us to help step in to convert this. Can you just tell us what is it, how it all kind of came about, and it's open and we're seeing patients, correct?
Yes, absolutely. No, patients started being admitted last week. It's going very, very well. And this is a 54-bed hospital. There will be 4 units. We are now, at this point, filled the first unit, and we will be opening one at a time as we scale up over the next few months. We are focused on kids and adolescents, but making sure that we're able to take care of kids that have more severe psychiatric illness that need this level of care, taking care of kids on the neurodevelopmental spectrum who need inpatient care, taking care of kids and adolescents that have co-occurring issues with addiction. And so all of these things are often difficult to get care for, that will treat a holistic approach. And we are very much wanting to be able to provide really state-of-art care for kids and adolescents with a range of psychiatric disorders that will enable us to do something that will really, move the bar, and how patients, and then importantly, anytime you're talking about kids and adolescents, you're talking about families, receive care and are supported for people that require inpatient hospitalization. And again, we see inpatient hospitalization as the most severe side of the spectrum that we're dealing with, but a really important one, that there has been a tremendous shortage of inpatient psychiatric beds for kids and adolescents in North Carolina for a long time. And our estimates from working with teams to get a sense of the magnitude of the issues, that there's at least 400 short beds in the state. This will move the bar in a positive direction. And in our area, in the Triangle, I think is going to be really, really helpful to ensuring kids and families are not boarding in emergency departments, which is a terrible place to be stuck. And when you're not able to get adequate treatment in a hospital.
So I was I was very impressed at how quickly this came about. I mean, it was last December, I believe, when it was first announced that this was going to happen, and the state said to UNC Health, "Hey, can you help us out here? We have an idea." I mean, how did this come about so quickly? And then, I guess at the end of November, started seeing the first patient.
Well, it came about quickly because, frankly, it's been an overwhelming crisis. And it was a wonderful partnership based on necessity. So I guess the old saying, never let a good crisis pass you by. I think the overwhelming mental health crisis and the fact that kids and adolescents have been boarding in emergency rooms has been weighing tremendously heavy on all of us involved at UNC Health and on the state. And there was an opportunity to partner around this. So I do think that Cody Kinsley, the Secretary of Health and Human Services, Dr. Carrie Brown, who's the deputy with DHHS around behavioral health, saw an opportunity as they were looking at their plans on what facilities could be there and their plans to shut down and transform the RJ Blackley building. That was a decision they made, and then reaching out to UNC Health to ask to partner. So I think that at that point, it was an amazing opportunity with the support of our leadership here, our Dean and CEO, Dr. Birx, who's a pediatrician and has been incredibly supportive about the need for us to scale up mental health services. And those of us working in psychiatry, there was great enthusiasm for doing this. And I think the good news is this is just a wonderful example of what can happen when people work together around a common goal. And in this case, the common goal is a really, really nice thing.
I mean, not to brag on our own company, but I mean, what does this say about UNC Health that we were the trusted partner in this, that the state looked to us for this kind of help?
Well, I think that the state appreciates that UNC, as the state health system, has a mission to serve people of North Carolina. And we also have, one of the largest mental health presences in the state and would be well poised. We're really good at running hospitals. We run hospitals across the state broadly. We run psychiatric hospitals and beds and have the skill set to do it and have the ability to have expertise in child and adolescent psychiatry. So I think that because of the expertise, content area expertise in this particular area, and then UNC Health's, great skill in being such a well-regarded healthcare system, with a mission that matches that of the state, that it was a unique opportunity to partner.
Great. Any last thoughts on as we go into ending the year on what we might expect across the state in mental health, but especially for children coming up?
Well, I think that we're excited about the expansion of multiple different forms of virtual care that are allowing us to reach people across the state, including kids and adolescents, partnerships with schools, launching the new hospital, but also launching an intensive outpatient program that will be run virtually, that will provide a higher level of care than just routine outpatient care. So we are really trying to be innovative and figure out how we can expand our footprint to do our part in meeting the needs of kids and adolescents in North Carolina. But it's an exciting time in terms of the resources that are now going to be more available. The investment by the General Assembly in North Carolina DHHS of almost $750 million will allow for expansion of mental health services broadly too. So I think all of these things are making me feel much better about what we may see moving forward.
Great, and thank you so much. That's all we have time for today. Many thanks to our subject matter expert, Dr. Samantha Meltzer Brody, Chair of the Department of Psychiatry with the UNC School of Medicine. And thank you to our listening audience for listening to Big Answers for Little Patients, brought to you by UNC Children's. We hope you'll join us for future episodes. For more information on UNC Children's, go to uncchildrens.org and subscribe to Big Answers for Little Patients wherever you get your podcasts. Until next time, thanks so much.